My name is Bobby Carmona. Today is September 9th, 2018. This is my lab video exercise submission. I will be doing this via photograph of the anatomical position. This is the anterior and posterior planes. I will be using these to highlight the different anatomical regions. To start, I will identify the cephalic region, which is also consistent of the skull and the face. This also has different regions like the frontal, which is the forehead. We have the otic, which is the ear. We have the buccal, which is the cheek. We have the nasal, which is the nose. We have oral, which is the mouth. And we have the mental, which is the chin. Here we have the axillary region, which is the armpit. We also have the brachial, which is the arm, and the antebrachial, which is the forearm. We also have the manus region, which is also consistent of the pollex, which is the thumb, the carpal, which is the wrist. We have the palmar region, which is the palm of the hand. We also have the digital, which are consistent of the digits or the fingers. We also have here the femoral region, which is the thigh, the patellar region, which is the anterior surface of the knee. We have the crural region, which is the shin. We also have the pedal region here, which is also consistent of the tarsal, which is the ankle. Also, the hallux, which is the great toe. We have the fibular region, which is consistent of the lateral side of the shin. We have the inguinal side region, which is the groin. We have the coxal region, which is the hip. We also have the umbilical or navel region, and this is inferior to the abdominal region here. We also have the sternal or breastbone region, which is medial to the thoracic or chest region. In the posterior view, we have the occipital, which is the base of the skull, and the cervical, which is the neck. We have the acromion, which is the shoulder. We also have the vertebral, which is the spinal column, consistent of also the thoracic area and the lumbar region. We have the olecranial, which is the cubital back of the elbow. We also have the gluteal region. We have the popliteal region, and which is the hollow behind the knee. We also have the sural region, which is the calf. Towards the inferior side, we also have the plantar or the sole region, and we also have the calcaneal, which is also the heel region. These all consist of the regions of the anatomical views of the body, and again the anterior and posterior views.